first up is Louise from Langston, South Cumbria. So take your time, and we can, well, I think we'll save the discussion for the Q&A, but do take your time, Louise, and tell us what we need to know. Over to you.
Okay, thanks for that. Thank you. Can you hear me okay?
We can.
Yeah. So I can't share my screen for some reason. It's been disabled.
Louise, I can very quickly add you to do that if you like, and otherwise if it doesn't work, I've got a copy and I could present for you, but I'll just try and add you now and you should be able to do that.
Thank you.
You should now have permission to do that, so I'll just leave you to have a go.
Yep.
Okay. Can you see that now?
Yes, we can. Perfect.
Wonderful. There we go. Okay, so obviously I'm from Langston, South Cumbria. So just a bit of background as to where we are with our sort of suicide prevention and self-harm programme. Helen's on the call and will come in a little bit as well. So across Langston, South Cumbria, we have a suicide prevention logic model. This is just the sort of front sheet of that logic model, and what sits behind it is a number of actions. We identified self-harm early on because we were one of those first sites for suicide prevention funding from NHS England. So we've been working around self-harm for quite some time, really. So that's just to highlight our logic model. What work we've got underway.
Louise,
yeah?
sorry to interrupt. I'm just wondering, the slides are a bit small on my screen, so I don't know if you want to go into slideshow view.
It's on slideshow view on mine.
Oh, right, okay. That's fine, probably just my screen then. Might just be my screen.
Okay, well, apologies about that.
No worries, don't worry, that's fine. I'll just try and I'll make my screen bigger. That's fine. Sorry, I'll shut up now.
Okay, no worries, Nav. So in terms of what work we've got underway, we have a well sort of rounded real-time surveillance data system in Langston, South Cumbria, which we established back in 2018. We've now sort of broadened that, and what we're receiving in real time is self-harm and attempted suicide data from our NWAS colleagues. We're using that to make sure that we are an intelligence-led system, and that we're using it to improve, to develop our improvement plans across all areas of the system. I mean, we've got Marie on here from our public health colleagues from
Louise, I'm really sorry to interrupt again. All I can see is the logic model. Have you advanced the slide? Because I reckon we're probably seeing something different to you.
Yeah.
All right, now it's moving.
I think when it goes on when I'm putting it onto the full screen, it's not doing it.
All right, okay.
It's Zoom. You really shouldn't use Zoom. You should use Teams. But anyway.
Do you know what, Louise? We shouldn't use any of them. And actually, it would be much nicer if I was visiting you face to face. But there you go. We're stuck with it. So we're on self-harm workstream progress at the moment. Is that the slide we should be on? Okay, thank you.
That's right. Yeah. Sorry. So as I said, we now get self-harm and attempted suicide data from our NWAS colleagues, and in a slide a little bit further on, I'm going to showcase some of that data and what that looks like. We've also completed the 10 safer care standards, which obviously you guys lead from NKISH, and we've done that on an annual basis with our trust colleagues. And then from that, we use it to develop improvement plans, and obviously self-harm forms part of that 10 safer care standards. I'm going to let Helen talk a little bit around the self-harm task and finish groups that she's established.
Okay, thanks, Louise. So the self-harm steering group has a good representation across the footprint, really, from all members. So it has a good representation from primary care to grassroots community groups that all come together to really shape how the self-harm work is being carried out. So for this year, we've developed the self-harm practice guides, which is to support all our community groups. So we've just finished our 3 practice guides, which are focused on children and young people, adults, and professionals and all agencies, so that we can really raise the awareness of self-harm, why self-harm is there, what the context is, obviously the same as some of the areas that we've covered today, but really to push that through all of the sectors that we're working with. We've obviously supported those guidelines with the knowledge that we need to make sure that everybody has the resources that are applicable to their areas, so that they can support people that they come into contact with. So we've made sure that they've all got localised and national helpline resources. All of this obviously aligning with the NICE guidance, which lovingly will change in a few months, and we'll have a nicely piece of work to do again, but all for a good cause. The resources themselves are obviously, with the competency frameworks, has been looking at training as well, so making sure that people have the skills and competency to support people, because I think that was what the self-harm steering group was really identifying, is that they needed to make sure that people were confident to be able to support people in the same way, and obviously to start to be confident with those conversations. So we've been putting a lot of work behind the training side as well. So we've commissioned some harmless training at level 2s and 3s to roll out across the footprint, to support these practice toolkits. Within Lancashire, sorry, we've been developing the self-harm safe kits, which have been co-produced with people with lived experience and professionals across the footprint, and they're just being analysed and hopefully being produced and released in the very near future. So that's been something that was developed originally in Cumbria, and that we've obviously lessons learned and moved forward and been able to work in partnership with Every Life Matters to make that happen. So there's been some really good partnership working and some good practice that's been kind of shared. Is that back to you, Louise?
Yeah. We've also got a huge suicide prevention campaign, which we've been running since the start of the pandemic, really making sure that our local communities are aware of the support services that are out there. And our next phase is around CYP. It will also include things around self-harm advice, etc. And it'll link with those self-harm kits, which are being developed in partnership with Lancashire Mind. We're working with the trust around a discharge pack, making sure, I know Nav, you sort of mentioned safety plans, that will form part of that discharge pack. It'll include information, services to access, etc., and that will be given to anybody that is discharged from community. So it aligns with the 10 Safer Care standards in terms of, you know, that they're aware of what's available, that their, you know, families and carers are included in it. So that work is well underway and hopefully near complete now. Our police colleagues work in partnership with LSCFT. You know, they're right on the front line, our police colleagues, and feel a lot of demand. So they, you know, we have street triage and synergy cars out across our area, and they are working with people that are obviously self-harming and looking at how we join those dots together. And we also have a frequent attenders team as well to support some of that work. Examples of some of our RTS self-harm reports, and I apologise because if your screen's small, you're never going to see this anyway. but you know, I will share this updated version. We're able to profile all of the NWAS demand, and we get this data across the whole of the Northwest, and we get it on a weekly basis. And we're able to, you know, produce profiles in terms of, so this little chart, which will be absolutely minute, so apologies about that. We can map days of the week. We can see when our biggest demand is for self-harm. We're able to map type of self-harm. That the most common is around threatening suicide. The way NWAS code their data, they used to have about 50 different, about 100 different codes for self-harm. They have changed the way that they are coding currently, so it will change the way our data looks. But you know, we're getting this data across all ages, and what we're trying to then do is triangulate that with other data sources that are within our communities, within the crisis teams, with our schools, to then really build up a picture of where the pressures are within our system, a heat sense of areas that we need to target, and just become more intelligence driven. In terms of the CMHT transformation work, as sort of you said, Nav, it's around making sure it's within that community. And this is an example of the model that is being adopted across Langston, South Cumbria. The IRS, which is the Initial Response Service, is very much crisis focused. You know, there will be no wrong door. Anyone will be able to access the IRS teams, and then they will be either transferred out into the voluntary sector, or they will be then put into their primary care networks and locality sort of community services. As I said, this, I mean, it aligns with the CMHT transformation, and work is, you know, this is starting. It is a big journey. It's a lot of work to do, but hopefully by the end of the program of work 23-24, you know, we will see a lot more of our services deliver locally in the community and accessible to all that need it. What are our next steps? So again, looking at the intelligence, we need to do a self-harm audit. We did one about 4 years ago now. Obviously things have moved on, and this will then feed into that CMHT, the crisis transformation and liaison services as well. As we've said there, we're improving access to frontline primary care services, making sure that we're identifying problems at the earliest opportunities, you know, to reduce the escalation risk for individuals. You know, I'm not going to read through all of them. You can see that yourself. So, you know, I think we're moving in the right direction. There's lots of pressures, vacancies, you know, recruitment of staff, but it's how we work together as a partnership and a system with our voluntary sector organisations, and making sure that we're getting patients at the right time and in the right place, and they're being seen by the right people. So that's a very quick overview of the work that's underway across Lancs.